Hi there and welcome back. Let's continue with the aneurysms, and in this session we will review ascending aortic aneurysms and the causes, symptoms, radiology, treatment and surgical considerations. Ascending aortic aneurysms are the second most common aortic aneurysm to abdominal aortic aneurysms. Most ascending aortic aneurysms are diagnosed in patients in their sixth and seventh decade of life. They are commonly diagnosed later in life and when the aneurysm is large. These aneurysms are located above the heart and can cause the aortic valve to leak. Patients with connective tissue disorders or those with a bicuspid aortic valve are usually diagnosed earlier in life. Patients with bicuspid aortic valve will be diagnosed earlier in life because these patients will likely have a murmur that initiates a workup. Approximately 2/3 of patients with a bicuspid aortic valve will develop an ascending aortic aneurysm during their lifetime. Patients with Marfan's disease, Ehlers-Danlos syndrome, Louis-Dietz syndrome, or familial thoracic aneurysm syndrome will be screened and diagnosed as a young child or adolescent. Although some patients with connective tissue disorder will not be diagnosed until the time of an aortic rupture or aortic dissection. In such cases, the patient and the family will undergo genetic counseling and testing to confirm the clinical suspicion. Ideally, these young patients will be monitored carefully through their young life for change in the aortic diameter. These patients need a multidisciplinary team to care not only for the problems with their cardiovascular system but for problems affecting other organ systems. Giant cell arteritis is an inflammatory disease of medium and large sized arteries which can affect the ascending and aortic arch and lead to formation of an aortic aneurysm. Most patients will have a history of temporal arteritis prior to making the diagnosis of a thoracic aortic aneurysm. If patients have a small ascending aortic aneurysm, they may be a candidate for systemic steroids. Regardless, they need careful monitoring of their aortic aneurysm. That's the basics of ascending aortic aneurysms. Causes. Most common causes of ascending aortic aneurysms are long-standing high blood pressure and smoking. Lifestyle modifications is very important when managing such patients. Most patients, so that's about the causes. Let's talk about the symptoms. Most patients with ascending aortic aneurysm do not have any symptoms. The most common symptom of an ascending aortic aneurysm is a dull, vague chest pain. Some patients will have symptoms related to compression of other structures in the chest like the trachea or esophagus. Patients can have symptoms like shortness of breath or fatigue secondary to leak in the aortic valve. The aortic valve will be stretched as the aneurysm grows, leading to incompetence or the leakage of the valve. Radiology. So most ascending aortic aneurysms will be discovered on chest X-ray or other imaging studies of the chest. The chest X-ray is usually performed to work up other medical problems. Although echocardiograms or the ultrasound of the heart will provide the first clue that an ascending aneurysm is present. Once the aneurysm is discovered either by chest X-ray or echo, the exact dimensions and the extent of the aneurysm is better delineated by MRA or CTA scan angiogram. How about the treatment? The majority of aneurysms can be treated medically until the aortic diameter has reached approximately 5 to 5.5 centimeter. The medical approach to ascending aortic aneurysms emphasizes blood pressure control, smoking cessation, low cholesterol diet, and a light aerobic exercise program. Beta blockage like a metoprolol or atenolol is the mainstay of the medical regimen because it lowers the heart and blood pressure, which in turn lowers the stress on the aortic wall. Beta blockers have been shown to decrease the rate of growth of aortic aneurysms in a small study of Marfan patients or the patients with Marfan syndrome. Surgical considerations. The two main reasons to operate on an ascending aortic aneurysms is to prevent a rupture and increase survival. The current guidelines for surgical treatment of ascending aortic aneurysms are based mainly on the expert opinion rather than concrete evidence. So with that, let's take a break here and see you soon. Take care. Bye now.